Microgestin Fe is a combination hormone medication used to prevent pregnancy. It contains two hormones, norethindrone, which is a progestin, and ethinyl estradiol, which is an estrogen. During the fourth week, there are 7 inactive tablets that contain a small amount of iron, ferrous fumarate. These inactive pills are meant to keep you in the habit of taking one tablet each day and do not have enough iron to treat iron deficiency. In addition to preventing pregnancy, birth control pills may make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and also treat acne. It is important to note that using this medication does not protect you or your partner against sexually transmitted diseases such as HIV, gonorrhea, and chlamydia. The recommended daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. Before starting Microgestin Fe, it's important to read the patient information leaflet provided by your pharmacist. This leaflet contains crucial information on when to take your pills and what to do if you miss a dose. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. It's best to pick a time of day that is easy for you to remember, and take your pill at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. It is very important to continue taking this medication exactly as prescribed by your doctor. Follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. Pregnancy is more likely if you miss pills, start a new pack late, or take your pill at a different time of the day than usual. If you have vomiting or diarrhea, you may need to use a backup birth control method, such as condoms or spermicide. Taking this medication after your evening meal or at bedtime may help if you have any stomach upset or nausea with the medication. You may choose to take this medication at another time of day that is easier for you to remember. No matter what dosing schedule you use, it is very important that you take this medication at the same time each day, 24 hours apart. Your pill pack contains 21 pills with active medication and 7 reminder pills with iron. Take one active pill, with hormones, once daily for 21 days in a row. Take one inactive pill, with iron, once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. You should have your period during the 4th week of the pack. After you have taken the last iron tablet in the pack, start a new pack the next day whether or not you have your period. If you do not get your period, consult your doctor. If you are taking certain medications that can interact with iron, ask your doctor whether you should throw away the reminder pills, iron tablets, each day rather than taking them. Iron can decrease the effect of these medications. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If your period begins on a Sunday, begin taking this medication on that day. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Ask your doctor or pharmacist for information about how to switch from other forms of hormonal birth control to this product. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Side effects of Microgestin Fe can include nausea, vomiting, headache, bloating, breast tenderness, and swelling of the ankles/feet. You may also experience vaginal bleeding between periods or missed/irregular periods, especially in the first few months of use. If any of these effects last or get worse, it's important to let your doctor know. This medication may also raise your blood pressure, so be sure to check it regularly. Remember, the benefits of this medication are considered to outweigh the potential side effects for most people. If you experience any serious side effects, such as lumps in the breast, mental/mood changes, severe stomach/abdominal pain, or unusual changes in vaginal bleeding, contact your doctor right away. Microgestin Fe may rarely cause serious problems from blood clots, so seek medical help immediately if you experience symptoms such as chest pain, sudden dizziness, or trouble speaking. While a serious allergic reaction to this drug is rare, it's important to get medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, swelling, or trouble breathing. If you notice any other effects not listed, be sure to contact your doctor or pharmacist. Remember, it's important to discuss any concerns or questions about this medication with your healthcare provider. If you are a smoker and over 35 years old, it's important to avoid using Microgestin Fe, as it can increase the risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure. It's important to keep this medication out of reach of children, as accidental overdose of iron-containing products can be fatal for children under the age of 6. If an overdose does occur, seek medical help immediately or contact a poison control center. Before taking Microgestin Fe, it's important to tell your doctor if you are allergic to any of the ingredients, or if you have any other allergies. You should also discuss your medical history, especially if you have a history of blood clots, high blood pressure, cancer, diabetes, heart problems, liver or kidney disease, or if you are nearsighted or wear contact lenses. If you have diabetes, this medication may affect your blood sugar levels, so it's important to monitor your blood sugar regularly and inform your doctor of any changes. It's also important to tell your doctor if you will be having surgery or if you will be confined to a bed or chair for a long time, as this can increase your risk of blood clots. Microgestin Fe may also cause blotchy, dark areas on your face and skin, so it's important to limit your time in the sun and use sunscreen when outdoors. If you wear contact lenses, you may develop vision problems, so it's important to contact your eye doctor if you experience any issues. It's important to note that it may take longer for you to become pregnant after you stop taking birth control pills, so you should consult your doctor if you have any concerns. Additionally, this medication should not be used during pregnancy, and if you become pregnant or think you may be pregnant, you should inform your doctor right away. Finally, Microgestin Fe may decrease breast milk production, so it's important to consult your doctor before breastfeeding while taking this medication. It's important to be aware of potential drug interactions that may change how Microgestin Fe works or increase your risk for serious side effects. Some products that may interact with this medication include certain combination products used to treat chronic hepatitis C, drugs used to treat seizures, HIV drugs, and others. It's important to inform your doctor when you start any new drug and discuss if you should use additional reliable birth control to ensure effectiveness. Also, be sure to tell your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. Additionally, this medication may interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you are taking Microgestin Fe. Remember to keep a list of all the products you use and share it with your doctor and pharmacist, and do not start, stop, or change the dosage of any medicines without your doctor's approval. If you or someone you know has taken too much Microgestin Fe and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can call 1-800-222-1222 for assistance, and in Canada, reach out to a provincial poison control center. Symptoms of an overdose may include intense nausea and vomiting, as well as sudden or unusual vaginal bleeding. It is important not to share Microgestin Fe with others. It is recommended to have regular complete physical exams, including lab and/or medical tests such as blood pressure, breast exam, pelvic exam, and pap smear while taking Microgestin Fe. Follow your doctor's instructions for examining your breasts and report any lumps right away. It is also important to keep all medical and lab appointments. It's best to consult your doctor for more details on the benefits, daily dosage, and the optimal timing for taking Microgestin Fe. If you miss a dose, follow the instructions in the package insert. You may need to use additional birth control methods, like condoms or spermicide, to prevent pregnancy. If you have trouble remembering to take your pills, talk to your doctor about using a different form of birth control. Remember to store Microgestin Fe at room temperature, away from light and moisture. It's important not to store it in the bathroom and to keep it out of reach of children and pets. When you no longer need it or when it's expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. And remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.